Centre for Biomedicine, Self and Society is a place where we're trying to integrate humanities and social science research in conversation with biomedical science and public health colleagues. So our aim is to do, to an extent, humanities and social science work on biomedicine and public health, but also, more importantly, to do work with them. So to co-define research aims and work together on outputs that can speak to a whole range of different stakeholders from within and beyond academia.
It's a really exciting melting pot of different individuals from a variety of disciplines who all come together to support each other, working individually as well as collectively on really important questions that put the self and society at the forefront of our research around biomedicine.
Nowadays, I think the people most inspire me actually are the younger scholars that I work with, the younger colleagues who are full of enthusiasm, fantastically bright, really hardworking, and who take their work at least as seriously as I do. So to see that commitment and that hard work and that sense that what people are doing is important, to see that in my younger scholars and to be able to hopefully help to nurture that and encourage that really inspires me.
Interdisciplinarity is incredibly important to me because it's what I feel I can really contribute to academic spaces. I trained initially as a historian and then as a lawyer and then as a social researcher and then as somebody with specialism in social policy. And so I feel like one of my kind of unique selling points as an academic is that I can bring all of these different fields into dialogue with one another, and I can show how creating that dialogue helps us to move past things that are potentially a little bit stale in the areas that have been studied before. And I think the great thing about the Centre for Biomedicine, Self and Society is that I'm allowed to do that. I'm allowed to engage in that interdisciplinary work. And I'm not being asked to define myself by reference to just one discipline or another. I'm allowed to embrace the fact that my education was made up of exposure to a range of disciplines, all of which have something to offer.
My research concerns the discursive and epistemological histories of post-AIDS and biomedicine related to HIV and AIDS, particularly after 1996. Recently, I've been working on research related to gay men's health, sexually transmitted infections, and public policy for sexual health education here in Scotland. This has been particularly related to a lot of recent ideas in the media about how we should continue to develop LGBT issues and education in public schools and in education generally. So it's a particularly important topic for us to approach here in the center.
My project investigates how AI is being used in robotics in surgery, digital methods that help diagnose disease, and the use of sensors and other tools, for instance, companion robots, to support those who may be ill or frail at home. While such developments hold the promise of improving health and social care, they are also raising social and ethical issues that we should all be involved in discussing. For my project, I am speaking to a range of people, including AI developers and healthcare practitioners, to see what they think about these developments now and in the near future. As a social scientist, I am particularly interested in exploring the ways in which these technologies may affect the relationships we have as we give or receive healthcare. I am currently conducting interviews with stakeholders based in the UK, Europe, US, Australia, and New Zealand in order to gather information about and views on artificial intelligence and robotic technologies in health and social care. I hope that this work will inform policy and help those involved in artificial intelligence, robotics, and health and social care to deal with some of these social and ethical concerns.
I am an obstetrics and gynecology specialty trainee in NHS Lothian. I'm currently on secondment to the Centre of Biomedicine, Self and Society for the inaugural Visiting Scientist Fellowship, which is a dedicated program that allows scientists and healthcare professionals to explore societal and ethical aspects of health and medicine. The theme I most closely identify with at the Centre is the Beyond Global one, and as part of this overarching theme, I am involved in conducting qualitative research on the lived experiences of pregnant women from ethnic minority backgrounds in Edinburgh, as well as performing a systematic review and meta-analysis of the most effective antihypertensive treatment in Black pregnant populations. Being a doctor demands an understanding of the antecedents of poor health. As a profession, our mission is not simply to diagnose, manage, and treat. Physicians should also act to prevent the root causes of illness and improve health, which I strongly believe also includes social and political inequalities. I was attracted to this fellowship at the CBSS because of the truly cross-disciplinary nature of the research conducted here. It provides me with the opportunity to think and learn about health equity and advocacy of medicine in its larger social context, thereby providing a more holistic understanding of healthcare systems.
As a social scientist working at the intersection of medical sociology, critical public health, and healthcare improvement, I really value the opportunity for interdisciplinary work that can enable a better understanding of healthcare service improvements, but also theoretical and conceptual insights into different phenomena around biomedicine. And one of the ways that we've sought to do that recently is through a study around abortion care during the COVID-19 pandemic. So COVID-19 has resulted in significant changes to the provision of abortion care across the 4 nations that really warrants a rapid research response. I'm working with colleagues across Usher and NHS Lothian working in clinical services. We've been able to undertake a qualitative study exploring the experiences of women who are accessing abortion care during the pandemic, but also health professionals who've been involved in abortion care and who have really pivoted and turned to providing care using telemedicine. And the reason why this is important is because not only does this provide insight into ways to improve the service that women experience, this essential healthcare for women in Scotland, but it also provides real theoretical and conceptual insights into the relationship that women have with home and also the provision of healthcare within home settings, something that we can learn from and take forward in other dimensions of our work in the future.
The piece of COVID-related work I would like to talk about today is a piece co-authored with colleagues who are historians, social scientists, anthropologists, and lawyers, both from the Centre and across the university. And it is a piece we wrote for Wellcome Open Research. The piece was originally written as a response to a model of segmenting and shielding proposed by colleagues at Edinburgh University earlier this summer as a potential way out of the lockdown. In this piece, and I think it's particularly relevant to the current public health, social, political, and media discussion, we try to illustrate the importance of involving experts in social sciences and humanities in the development and deployment of any public health measure, and in properly weighing their potential harms and benefits. We point to the long and problematic history of segmenting parts of the population in global public health. We point to the need of engaging in transparent and systematic deliberations about whose interests and which interests are being traded off, and whether these are ethically justified. To the need to rigorously engage with how any such model might adversely affect existing social and health-related inequalities, and the need for a far more nuanced discussion on the concept and use of the term vulnerability, which is a key concept featuring in many of the debates around the pandemic. We also consider in this piece how such model might problematically shift responsibility from institutions to individuals, how such models run the danger of reinforcing ageist, ableist, sexist, and other discriminatory norms, ideas, and practices. And that's true both for public health policies as well as practices around COVID. And finally, we end with a renewed call to move away from the idea of the young, healthy, white, and able-bodied person as the central or starting point of public health concerns and deliberations.
The CLAP study is a research project funded by Medical Research Scotland through a COVID-19 research grant, in which we seek to understand frontline NHS staff experiences of working in critical care during the coronavirus pandemic. We know that staff experience is an important component of the quality of healthcare, as well as being an important end in and of itself. We also know that coronavirus is placing huge demands on the NHS and on critical care units in particular. But we don't know how the work that NHS staff is doing has changed, what helps them to cope and what hinders, or how they could be supported better, both now and in future outbreaks. In this research, we're conducting interviews with NHS staff across 4 hospitals in Scotland and England to understand more about their experiences. Our work is being conducted rapidly so that it can help inform the response to coronavirus going forwards, and we will be communicating our findings to healthcare managers during the coming months. The CLAP study is a collaboration between social scientists at the Centre for Biomedicine, Self and Society, as well as clinical researchers in Edinburgh and around the UK.
The Centre for Biomedicine, Self and Society offers breadth and depth in addressing issues in medicine, health and healthcare that affect us all. Our diverse theories and methods from across the humanities and social sciences come together with new synergies. They take us from archives to internet discussion boards, from observations in laboratories to in-depth interviews. Engaging and engagements are core to how we work, whether with each other, with biomedical and other scientists and disciplines, with practitioners, decision makers, or diverse publics. And through such engagements, we aim to deepen our knowledge and understanding in inclusive and impactful ways for wide benefit. This is all the more important as the inequities and inequalities in our societies have been so starkly revealed as we lived through the pandemic. At the very least, we need knowledge practices and policy solutions that will help to create a more socially just world. We believe this requires interdisciplinarity and multiple and diverse engagements.